Welcome to The Bridge, Your Health, Your Voice, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
You're here on The Bridge with Dr. Eleanor Fleming and future Dr. Liz Knight when we're talking about oral health. My question to Dr. Fleming and then you, Elizabeth, when did dentistry become a thing for you? Said, you know what, this is what I want to do and where I want to go.
So Rodney, I wish I could say that I had a story of, walking across the field and someone looking at me and saying, hey, you can be a dentist. I'm actually a dentist as my second professional degree.
Okay.
So I didn't grow up wanting to be a dentist. I was reasonably good at science and math courses, but I did not see that as my career, right? I mean, I went to undergrad at Vanderbilt University and was very fortunate to have some amazing professors who were like, you're smart, you should get a PhD. And so in the middle of working on my PhD in political science, and this would have been in the early 2000s, I had the opportunity to hear Dr. David Satcher speak. He had been the Surgeon General of the United States, so the nation's doctor, the head of the U.S. Public Health Service, and he commissioned the first federal report on oral health in 2000. So I'm sure some of your listeners may know that Surgeon General's reports have gone out about smoking, about tobacco, about a number of diseases. But it wasn't until 2000 that we had a national report on oral health. And I can't remember the opportunity where I heard him speak, but I happened to be in the room and he's talking about oral health disparities. And for someone who graduated Phi Beta Kappa from Vanderbilt within a doctoral program, I should have been smart enough to know, but I wasn't. And hearing him talk about oral health disparities and realizing that the disparities that he was talking about were people who look like me, it changed me. And before I knew it, I was writing my dissertation by day. And I took his report and him telling the story about the need for dentists, the disparities that largely Black, Hispanic, Latinx, American Indian, Alaska Native, Indigenous people face as a call to action. And so I decided that I would be a dentist. And my mama always taught me that anything that you see a lot of people doing, it can't be hard. So I'm living proof that anyone with any background, if you believe you can do it, you can do it. And so that became my trajectory towards dentistry and what I had hoped would be a career practicing at a community health center. And then 2007 hit. And November 2007, I'm reading the Washington Post, and there's this article by a journalist, Mary Otto, called For Want of a Dentist. And she tells the story of Diamante Thomas Driver in Prince George's County. And he was a 12-year-old kid who had brain surgery because of a cavity.
Wow.
And I remember looking at his face. And I will never forget the picture of Diamante and his mom, Miss Elise, at Children's National Hospital in D.C. And his face, he looked like the face of the kids at the local Boys and Girls Club where I grew up back home. He looked like the face of family members. He looked like the face of someone who, if my life had been different, would have been my kid.
Gotcha.
But here he was, and eventually he died. Right, so a 12-year-old kid had to die because of a cavity because his mom couldn't find a dentist. Yeah. And that's how I went from wanting to be a dentist practicing at a community health center to wanting to be a public health dentist, and here I am.
I love that story, Dr. Fleming. Thank you for sharing, and we'll delve in a little bit more about that because I took some notes on some of the things you mentioned. Liz, I was walking across a playground. Dr. Fleming, this was her second degree, her second profession. When did you know that, you know what, oral health is what I want to do? Being a dentist is what I want to do. When did you know?
So I knew in high school, it wasn't that I wanted to be a dentist. I knew I wanted to be in healthcare. And when I had certain interactions with like medical professionals and like hospitals or like private practice setting, not dentistry related, I knew I didn't want to do that. So when yeah. So when I went to the dentist though, growing up, and I was fortunate enough, the area that I grew up in, Richmond, is like an underserved community. So it's not like a lot of dentistry there, but I was fortunate enough to my parents, we were able to provide that for me at a certain time. And then we weren't able to, and then we were again. So when we weren't able to, that's when I started to get a little more appreciative of it. By the time I got a little grown, I saw the effects of when we weren't able to afford it, how it impacted me. Especially the people around me too, because we were close to underserved communities and everything. So going into college, I had to make a decision. My mom was like, my brother does engineering, my sister was in culinary arts, so I had to go into health. And so going into VCU, dentistry was big at VCU because of the dental school. So I thought it was a great way to like focus my attention on something that was hands-on, something I could actually make an immediate difference in patients' lives. That was the big thing for me. Like a lot of people come into the dental office and they lead with relief or at least a plan to actually make changes. And then going into school, I had to shadow a lot in school in undergrad in order to apply to dental school. So the shadowing experience just further supported the fact that I was really passionate about it. So once I started being an assistant right out of undergrad, it solidified it for me. I was like, I'm tired of assisting. I need to be the dentist because I want to get hands-on. I want to help people. You see the impact you're making. I was still in Richmond while I was assisting, so I got to serve children, families. Then I moved up to Northern Virginia with my family. I got to service like higher income, so I got a well-rounded experience of the dental setting. So just coming into school, I just knew I was like fired up for it. And then learning that there's only a certain percentage of Black dentists in the country, it just made me want to challenge myself even more to be a part of that community and a part of those people that are actually, like Dr. Fleming said, impacting and influencing our community, people that don't have access to care. So that was really important. So now I want to work in underserved communities for my career.
I love it. I love it. As I mentioned earlier, when I opened up, I talked about how after receiving some toothbrushes and toothpaste and oil literature, I want to let our listeners know I'm really serious talking about that. Like those things, those items are often asked for and an attraction when they're out at these events. And a lot of these events, health career events or community resource events, summertime, so events are starting to pile up now. They are addressing a lot of health disparities in our community. Dr. Fleming, you talked about the oral health disparities, which is one of the things that you are really passionate about in your work that you do here at the university. How are you implementing some of the things that you learned along your journey in order to address some of those oral health disparities that are prevalent in our community? I'm talking about prevalent now. I just was at an event 2 weeks ago and ran out of a whole box of toothbrushes for the school community.
Yeah, I mean, so one of the things that I hope that your listeners will take away, when we talk about oral health disparities, the disparities in general, and the degree to which those are often present in minoritized communities, I don't want anyone to take away that there's something about the community or people that is problematic.
Okay.
Right. These outcomes of diseases, whether it is a cavity, whether it's periodontal disease, oral cancer, like these are things that in a city like Baltimore City, where systemic racism is built into our environment, some of these things have nothing to do with people and everything to do with choices and opportunities. And I'm saying this bit, and I'm sure that your listeners know, but as someone who was the epidemiologist basically a public health, scientist who reported the data. It was bothersome to me to have to write the sentence that, the prevalence of cavities was higher among non-Hispanic Black people than white people, right? Because that suggests that there could be pathology or something that we as a community of people are doing. But the fact that, and Liz brought this up, Black dentists in the United States are 3.8% of all dentists. Black people are 13% of the U.S. population. And that difference in who are the providers and who are the people matter, right? We've seen this in a variety of health outcomes, and it's nothing that is new in terms of what we think of in terms of oral health. We also know that when Black and brown people who don't speak English well, go to see the dentist, often their experiences are different, meaning that they face discrimination. And it's no wonder that if you had a traumatizing experience, potentially, if you have an experience of discrimination, if it's harder for you to take time off to pay for this service that your insurance does not cover, are you going to the dentist? You probably aren't. And so the degree that we live in a country where access to dental care is treated as a luxury, is treated as something that only people with means have, and we live in a city like Baltimore City, this isn't people's fault, right? Like there are bigger issues that led to the death of Diamante Driver than that tooth. And, to the degree that we're able to understand and connect poverty, housing insecurity, food insecurity, the fact that people don't trust their water, like the fact that people with anxiety and stress and depression are smoking tobacco or drinking alcohol, like all of these things, in addition to the brushing and the flossing, matter. And so I just want to make sure that we contextualize health disparities in this larger context of systemic racism, right? The fact that we can live, or at least I live in West Baltimore, I don't see a lot of dental offices. When I go back home to Franklin, Tennessee, I see dental offices everywhere. Like, why is that? So as we think about why people, when you provide toothbrushes, are coming up and seeking information, it's because we as community members, the work that the patient program is doing is so important. So to your question of what am I trying to do, right? At a big level, I'm trying to support dentists in implicit bias training so that when patients come in who may be different from them, and again, naming 3.8% of all U.S. dentists are Black, how are they treating people? How are they checking their biases? I'm supporting, students like Liz who have this passion for wanting to do community-based practices, that they understand how racism, oppression, and all of the things that go into a tooth that requires surgical extraction, why that happens, and that they are equipped to intervene and support patients in care. And also just trying to make sure that the profession itself is doing its due diligence, right? We have ethics in dentistry, and one of those ethics is justice. And to me, justice means that you do work to help people in communities. You fix the teeth if the teeth need fixing. You support communities in, access to safe water, which we don't always have in Baltimore City. That you support schools and healthy environments. So I do that.
This is probably our first podcast interview, but we've spoken and exchanged emails and talked passionately about just that, about the oral health disparities, about the fact of the matter that there aren't a lot of dentists that look like you, that look like us. A lot of folks out there that have had some experiences that have turned them away to oral health or oral care, or for lack of better words, put oral health on the bottom of the totem pole. Because when I'm out at these events, that's who is coming up to my table wanting information on it. Black and brown folks, a grandma with grandkids, a Latin family, mom and dad, they have a couple kids. They're wanting to learn a little bit more about it. And if there's the dental or if there's an oral health table there at the event, I find my way to kind of point them in that direction. I'll give them the literature information that I have. Liz, jokingly, but also realistically, we talked about you literally just coming from an office, helping a patient out. When you hear Dr. Fleming talking about addressing those issues from the perspective of she's talking about being a Black dentist or being someone who has an understanding of the community, of the issues that some of the patients or potential patients are going through, is that something that kind of drives you to continue to do the work that you do? Being as though this is your last year, but going into once you finish graduating, I know you want to be a dentist, but I feel like you have a passion for wanting to help any and everyone that has issues with oral health, but particularly folks in your community.
Yes. So I think the best thing that's happened to me is going into clinic and starting off fresh with patients that don't have a lot of patient education, because they've been able to vocalize how, when I break down their treatment for them, how they actually understand how it's affecting the rest of their systemic health. And they've never gotten that education before. And a lot of people in other communities get that from toddler and above. So when I have people in their like middle stage of life, you got 40-year-old, 50-year-old, 60-year-old and plus saying they've never had dental education, even health, like systemic education, and now they're ready to get their oral health straight. I'm like, man, I wish we had done this about 30 years ago when we could have really focused on keeping the natural teeth healthy, working on dietary counseling, tobacco cessation, like all of these things people don't understand. It influences their oral health and then systemic health. The mouth is the portal to the body. So the fact that oral health has not been pushed or focused on more in not only our schools, but in even our fellow medical professionals, so our physicians and things like that, there's a lack of dental education everywhere. Yeah. And because it's so hard to access for some people a dental clinic or somewhere affordable to get this education, we have no other option. So that's why the school is so important for people in Baltimore, because we offer, we accept Medicaid. We offer lower cost of treatment. We have a clinic where you can get all of your services in one central location for those people that don't have transportation. So all those small things are actually big things that people don't think about because we have privilege everywhere else in life. So it's very important for me. Like, Baltimore is kind of like the Richmond community I grew up in, like less education. A lot of changes happen over those times. And then you see the breakdown and people don't address things until it starts hurting, until it becomes an emergency, and that's too late. So that's my emphasis on patient education when I'm sitting with my patients is bigger than even sometimes the treatment, you know? Yeah. The patient education, you need that first to avoid having to do treatment in the future.
We at the Patients Program understand the importance of educating our community members. I know my role is educating folks on non-clinical research when I'm out and about in the community. And when I break it down in the language that they understand, I'm not out there handing out medical journals. I'm not out there handing out, 10, 15 slide decks on about the importance of research. Nah, that doesn't work, right? When we're literally talking about, and Liz, I'm going to go back to you. You talked about the mouth is the, I forgot how you worded it, but you said the mouth is the
portal to the body.
Portal to the body. We've talked about presenting opportunities for oral health education to groups here in West Baltimore specifically. I know that's something we're going to still find a way to get that done beyond Patients Day, but just in a way folks understand. How huge of an impact do you believe that if you were able to provide that information in a way that they understand would impact a community?
Game changer. Game changer. Right? I mean, to Liz's point, right? Most people, Liz and I, the dentist, the hygienist, like, we understand oral health. Most people, and it doesn't even matter your level of education, when we start talking dental talk, no one understands. But when you explain to people, I can look in your mouth and I can tell you if your diabetes is controlled. I can look in your mouth and I can tell if you use cannabis. I can look in your mouth and guess that what I'm seeing is potentially a consequence of that medication that you're taking that causes dry mouth. And you read that bit about dry mouth if you read like the counter indications on your prescription bottle, but you didn't think that's why I got these cavities at the base of my teeth. Like all of these things, when you explain to people in ways that they understand, folks get it. But it's taking the time to talk to people. It's trusting that when people tell you that bad things have potentially happened to them or they feel some kind of way about systems, you trust it. And it's providing that safety to where they're going to want to come back and be Liz's patient. They're going to come back because they know that Liz is willing to listen and trust. So going to community, wherever community is gathered, and having conversations with people about life and about even looking at, it's so real. I can look at, so I stare at people's teeth because I'm a dentist. 9 times out of 10, if I'm staring at your teeth, I can basically tell a story about what potentially happened to you. So for example, most folks who don't have their back teeth, 9 times out of 10, they started having issues with those back teeth when they were teenagers and it got worse. And so by the time you're seeing them early 20s, 30s, yeah, they're missing teeth. Or that, senior adult, the elder who has no teeth and probably grew up thinking all old folks' teeth fall out. No, they don't. It's because that person didn't have access as a kid to a dentist who could teach them and apply things like fluoride varnish or put protective coats on teeth called sealants to prevent decay. So this myth that like all old people don't have their teeth and need dentures, nope, you can maintain that.
That's a segment right there. That is a segment right there. And I'm sorry, guys, listeners, by me getting excited. And I want to give Dr. Fleming and Liz kudos for keeping their poise when they're talking about a topic that I know they're really passionate about, because I hear the passion when we've talked before on phone calls and meetings and we met in Lexington Market. I hear the passion when they type and send me emails about how, Ronnie, I'm sorry we couldn't meet or I couldn't talk, but I really want to get on the podcast. So I commend you guys for keeping the poise, but you just said it right there. Like, you got to find a way where we can connect with the community, connect with this group out here who continues to put oral health on the back burner or just thinks that that's just what happens. Now, if I was to present this to a group of seniors saying, you know what, you don't have to lose your teeth. Like, that's the way you can prevent that. Like, that is something that, again, I believe is very beneficial for our community, for our group. And again, it talks to that whole point of meeting the community where they are, delivering the message and how they want to hear it, and then providing the results right there. So, that's
now I'm gonna tell you this next game changer. So wait for it.
Game changer 1, we're here. What's game changer 2, Dr. Fleming?
Okay, game changer 2. Would you believe me if I told you that your teeth aren't white, but actually are yellow? And this idea of having a bright white smile is not true. That's marketing. So the degree to which people think, oh, my teeth are healthy if they are white. No, because the actual color of your teeth are yellow. And for those of us who have pigment, we might have pigment on our gums. It's called physiologic pigmentation. Basically means that the melanin that made us brown is making our gums brown. That's not disease. That doesn't require laser treatment. Like, your gums are healthy. You're brown and your gums are brown.
Mm-hmm.
But as we know, that's not discussed a lot because, one, the lack of minority representation in not only our profession, but in the people educating communities. And then you have a lot of online teachers, YouTube professionals, and things of such. But that's why I take patient education so importantly, so they don't end up at Veneers by Vanessa instead of at a real dental office with a real certified dentist. Because like she said, like, people really do look at their teeth and they think if they're white, if they look like the tooth hasn't chipped any at all, it's healthy. And that's not the case at all. I literally, right before this morning, I was just explaining to a patient how he has a lot of damage to the teeth. Just because they're stable and they're not, broken doesn't mean that they're healthy. There's a lot of things under the gums that we're looking at, bone levels. We're looking at dental caries that are between the teeth that you cannot see. We can't even see it with our bare eyes. That's why we need all our instruments, our lighting, our air, water, all of that. So we're really here just to educate the community. My patient on last Friday, right when he sat down, he literally tells me every time, he's like, I just appreciate you so much because a lot of my friends come here and everything, and we all have different experiences, but his experience has been great because anytime he'll be hesitant to proceed with a treatment, I'll break it down in layman's terms. I don't speak dental terminology when I'm talking to patients. I don't even like to speak in dental terminology with faculty and students because it's just wide. We all know what we're talking about, but I want to break it down enough that they understand, they know why they're doing the treatment, they know what could happen if you do the treatment. They know why it benefits them, not only their oral health, but systemically why it's going to benefit you. So I need them to understand that before I even touch them. I need you to understand why we're doing this. And that's why, I'm able to get him to proceed with treatment. He's like, I feel comfortable because I get why I'm doing it. I'm getting why it's going to help my overall quality of life. So yes.
I spoke earlier about the passion that I see and have heard from the both of you, and I feel it coming out, and I love that. That's what the bridge is for. It's what our podcast is for, so we can speak about things that we are passionate about and, have had some lived experiences about it too, because key things, when you speak from a professional rank or a lived experience rank, which is who we deal with the patients program a lot. A lot of our researchers have tons of letters behind their names. And a lot of our community members have lived experiences. They're just as important. Your background, Dr. Eleanor, is a picture of downtown campus, right? My background, I'm in an office, I'm downtown. Liz, you're over at campus as well, School of Dentistry, beautiful new building. We're literally right across from Martin Luther King Boulevard, West Baltimore. What have been some of the challenges of addressing the community right across the street? And what have been some of the success stories that you've shared? Because at the end of the day, I know you want to help. I've talked to you. I've heard it.
So the University of Maryland School of Dentistry has had great successes in engaging the community. And one of the programs that I really want to highlight is work that's being done by my colleague, Lisa Bress, who is a dental hygienist. And she has had a program where she works with pregnant people in terms of connecting them to oral health care. Now, here's the secret. If you are a pregnant person with Medicaid dental benefits, you have access to care while you are pregnant and postpartum. I think it's postpartum for maybe 90 days. Most people don't realize that they have access to that level of care. And so what Lisa has been doing with a group of pregnant people from the community, talking about oral health, connecting them, and supporting them throughout the pregnancy, but also allowing them the opportunity to set their little ones up for optimal oral health. And again, the fact that I said before that you can save, you don't have to be an elder without teeth. When that infant is born, those teeth are present, right? And so to the degree that at 6 months, that baby is possibly going to have a tooth that shows up, a caregiver needs to be prepared within the first year or two to get that baby, that infant, that toddler to the dentist. Because even though there are so-called baby teeth and the adult teeth are coming, you don't want those baby teeth becoming diseased. The University of Maryland School of Dentistry and dental schools all over the country with pediatric dental programs see more kids than they should in the OR. So that means that you've got a kid who goes through full sedation, not the gas that just makes you feel good, but with the IV and the home being knocked out so that a dentist can do basically a mouth worth of work on a kid because you need to save those teeth for the adult teeth to come, right? So to the degree that we understand that the baby tooth falling out, you got to make sure that it stays healthy until it falls out. That you just can't give toddlers, juices just because, or send them to bed with milk in their sippy cup. Milk has sugar. Juice has sugar. Sugar and teeth cause cavities. Cavities cause pain. Pain cause you needing to come to the dentist. So what Lisa is able to do, and working with our neighbors who are experiencing pregnancy, is to provide them with the health that they need for a healthy pregnancy outcome, but also to support that infant, soon-to-be toddler kid, and making sure that the kid has optimal oral health. And again, dental surgery is important, not to take away from that. Gotcha. But I don't know that any of us really want to think about a 3-year-old having surgery because they have a mouthful of cavities that could have been prevented.
When I recognize champions who are passionate about their work, I've recognized 2 champions here that are passionate about oral health and addressing these disparities. I want to try to partner from the patient's program perspective for bridging that gap, right? That's why we call our podcast to Bridge, because this is a platform we can kind of learn from each other. There's a community right across the street from Martin Luther King and West Baltimore in general, but Baltimore at large. There's a community out there that we can walk across the bridge and meet them a little bit and figure out how we can address some of these oral health issues and oral health challenges. Liz?
A lot of patients think you can just come in and everything gets fixed at once. No, that's not the way it works. It did not happen overnight that your mouth got to this condition. So we need to take the time to get it back to a healthy state. So it's like understanding and communicating with the patient that this is not just a one-stop shop. This is a journey. And that's literally what I tell my patients. You just have to be on this journey with me. Trust me while I'm telling you step by step what we're doing. But when we reach the end goal, once that maintenance happens, there's all smiles. It's going to be a healthy, nice, natural smile. So
I love it.
Yeah, and I was just going to add, to the point of cost and having to make decisions as to where you spend your money. And again, like that's the shame in dentistry, right? That you have to sit and decide, am I going to get the New Balance shoes, or am I going to go get my teeth cleaned if I don't have insurance? And that's where I say, like, for me, that justice piece of dentistry and that ethic is where, and thinking about building that bridge, part of that building means that patients in our community members, period, have to advocate to say that, no, we want dental care the same way we have medical. Like, why are you giving us this system that doesn't work, that doesn't cover anything? Like, we also have to do that very important bit of advocacy, because how things work and look like right now, they don't have to be like that. And there are ways that we, as all people, have the power to say that we want that change to happen. And also with the bit of money, just reminding folks that, like, an ounce of prevention is worth a pound of cure. And so there's a reason that when your teeth aren't hurting, you still go to the dentist, right? Because you still need the x-rays and that deep cleaning that you can't do with the toothbrushes that you get from the community fairs. Like, you need regular oral health care the same way that hopefully you're getting regular mental health care, regular physical health care. Like, it all has to be the same. Like, these glasses, I can't keep the same prescription for 10 years.
Yeah. I mean, treat like a car, oil change.
Oh, exactly. Even better, oil change. You got to have that one. You can't just put gas in it.
If you could go back and talk to freshmen entering dental school, Liz, what would you tell her right now?
It's worth the pain and the suffering. And you don't even realize the impact you're going to make. That's really it. Like, I think I understand the importance of everything, but even understanding that, I still underestimate the impact that I will make in the future because of what I represent, because of who I am. I'm a Black woman and a dentist, a future dentist. So that in itself, I am going to make an impact in this world that I can't even imagine. So that's what I would say, just to keep me motivated, especially now we're taking boards. So motivation.
I got you. Dr. Fleming, when you stepped out of that, wherever you was, and you heard that speech, on oral health disparities, when you left out of that forum, that hall, what would you tell that Dr. Fleming right now?
The greatest times in your life will be when you move to West Baltimore. So get your bags packed, girl, and go and do what you got to do. And I say this with complete sincerity. Living in West Baltimore and being a part of the community that is across the street from the dental school has been the greatest life experience that I've ever had. And I remain grateful to my neighbors who are unhoused. I am grateful to, the ways in which I get to learn and navigate and experience this city, because it is a great teacher, but the people are even better. And from my heart, that is a truth in just how much I love this place.
Oh, man. I'm going to chop the mic on that one right there. I like that.
Before we go, we do have to give some actual oral health information today, that they brush for 2 minutes using little circles around their teeth. If they've got a little person who maybe doesn't have the dexterity, saying, go brush your teeth, little one, if you are a caregiver, take the time to brush the child's teeth. And after you finish, so you brush your teeth and you spit, rinse off your toothbrush, but don't rinse, because the toothpaste has fluoride, and for the fluoride to work, it needs to stay in contact with your teeth for upwards of 30 minutes. So if you just want to do something reasonably quick and easy, 2 minutes, 2 times a day, soft toothbrush, a toothpaste that has fluoride. It doesn't have to be expensive brand. It can be the cheapest basic, but make sure that it has fluoride in it. Take the time to brush your little one's teeth, spit, don't rinse.
Dr. Fleming, Liz, I really appreciate it. This was fantastic. Thank you for all the work that you guys do. And again, I know we will stay in contact on figuring out how we can continue to partner and bring some of this education right to the community, meet them where they are. I want to be a part of that. Patients program, want to be a part of that. So look forward to working with you guys going forward. And thank you.
Thank you for listening to The Bridge. Your health, your voice. To learn more about the Patients program, visit our website at www.patients.umaryland.edu.